to our first of webinars hosted by the New York State PTA Mental Health Task Force called Conversations on Mental Health. I'm Patricia Janko, the health specialist for New York State PTA, and I just want to give you a little bit of background. Recently, New York State PTA sent its members out a survey. Let's talk about youth mental health, asking parents, caregivers, families, educators, and others concerned about children to complete the survey to help us address youth mental health needs and concerns. This series has been designed to talk about some of those concerns. Joining us this evening, Helen Hoffman, President of New York State PTA, Kyle Belokapitsky, Executive Director of New York State PTA, all the members of the Mental Health Task Force. Our moderators for this evening are members of the Mental Health Task Force as well. Amy Heisack, our New York State PTA Wellness Coordinator, and Susan Fisher, the New York State PTA Resolutions Coordinator. At this time, I would like to invite our president, Helen Hoffman, to welcome everyone and start our conversation tonight. Helen?
Unmute. Thank you, Pat. And good evening, everyone. I'm happy that you could join us this evening. My platform as the New York State PTA president focuses on mental health crisis. For those who do not know me, addressing the mental health crisis is personal to me, as I am a survivor of a brother whose suicide at the age of 23. My brother's struggles began at the age of 15, when many of our students are now struggling. When I became president, the first thing I did was to appoint a mental health task force to address the mental health needs of our kids. And out of the work this task force has done, tonight is the first of a series of other webinars to address our students' mental health needs. I want to thank Patricia Janko and the Mental Health Task Force for putting this webinar together and being brave enough to start this important conversation with you. I also want to thank you, our parents, guardians, our teachers, administrators, our PTA leaders, for supporting kids, raising awareness to make every child's potential a reality. And from the bottom of my heart, I want to thank you. And let's get this conversation started. Pat?
Thank you, Helen, and thank you for those heartfelt words. Before we begin this evening's conversation, I want to state that this webinar series is in no way a substitute for professional help. The purpose of this webinar is to open up a dialogue with parents, teachers, caregivers, and students on mental health issues facing us all, how we can identify concerns and ask for help. Let's start this evening off as we engage in conversations on mental health, and let's talk anxiety. Amy and Susan, I turn it over to you.
Thank you, everyone. And I'm going to just take a quick moment and spotlight our guests so that we know, except they now moved. Add a spotlight. Add a spotlight. All right. So good evening again. And I would love to just jump right into having this conversation with our guests. So I'm going to ask each of you to give a brief introduction of yourself and start by answering the question, what is your definition of anxiety? And focusing on youth, right? So what is your definition of youth anxiety? Let's start with how I see you guys on my screen. So Dr. Nina Weisenreiter.
Hi, thank you for having me here tonight. So I am a school psychologist at Oceanside High School. I've been a school psychologist there for about 20 years. And last year, I became the coordinator of our high school's newly established wellness center. I'm also a clinical psychologist with a private practice for about 15 years on Long Island. And I guess when people often use the word anxiety to describe lingering nervousness or constant sense of tension or worry, I think it's kind of important to talk about the terms fear and anxiety when we talk about anxiety. Fear is the emotional response to a real or perceived immediate threat, whereas anxiety is often talked about with that anticipation of future threat. So anxiety is associated with muscle tension and vigilance and preparation for future danger and cautious or avoidant behavior. That's kind of something that I often think about when I think about trying to define anxiety.
Thank you. And thanks for bringing in that idea of fear with that. Dr. Owens, do you want to introduce yourself and tell us your definition of youth anxiety?
Sure. Thank you for having us tonight. This is such an important conversation, and really anxiety is something that I love to talk about with all different sorts of people because it's something that we all do experience. I'm a clinical child and adolescent psychologist, and I work at Northwell Health in the child psychiatry department, and I oversee a team of therapists who specialize in working with children with anxiety and OCD. And on the treatment side of it, I guess like the spin I will add to everything Dr. Weisenreiter said, which I agree with, is that I try to think about also, because anxiety is such a universal experience, maybe like the differences between anxiety versus an anxiety disorder, right? So like anxiety is actually a really normal and healthy human experience. We all have it and we need it, right? And the goal of anxiety disorder treatment is not to get rid of anxiety, it's to understand it better and like learn how to manage it. And that anxiety is our body's normal response to something that may not be going well, that does require our attention or does require some problem solving. And anxiety disorder is something where our alarm system is a little bit overactive, right? It's going off when maybe it doesn't need to be, or when it goes off, it's really loud and distressing in a way that causes us to respond to it in kind of unhealthy ways. And so I think that distinction is often helpful for people to understand because we really need two different kinds of responses for healthy anxiety versus like an anxiety disorder.
Thank you. And I really appreciate that alarm visual, right? Because I think everybody can relate to what an alarm does to you, right? And Mallory Polidro, can you please introduce yourself and tell us your definition of anxiety?
Sure. Good evening, everyone. Thank you for having me. I am currently the Director of Special Education at the Sewanaka Central High School District. Prior to this role, I was also a school psychologist within the Sewanaka Central High School District, and before that in the New York City Department of Education. Also have worked in some non-for-profit organizations as well. So not to be repetitive, my definition is certainly similar to that of Dr. Owens and Dr. Weisenreiter. When I think of anxiety, I also really think it's a very natural human response. I think that's what we've all been saying that is helpful to us. We want to know when there is a threat or a danger, how to react. It's that fight or flight syndrome. But when we talk about anxiety being of concern, a lot of times, especially with young, with youth and also adults as well, I think of anxiety is when we really focus on the uncertainty of what may happen. So it's a very subjective sense of fear, distress, or worry. I often call it like the what if syndrome, when we start to just focus so much on the what if, what may happen in a way that prevents us from really being present in the moment, engaging in the moment, and starts to really impact our well-being and our quality of life.
Thank you. And I'm sure a lot of parents on this call can relate to their kids coming, be like, and what if this happens? And what if that happens? And having to answer all those questions. That's really helpful. Thank you. So Meredith, I'm going to start with you and I'm going to ask you, anxiety is such a big overarching term, right? We kind of throw it out there and we're referring to a lot of different things. So are there different types of anxiety? Can you tell us a little bit about the different types of anxiety?
Sure, of course. So even within, I made the distinction before about healthy anxiety or normal anxiety versus anxiety disorder, but even within the realm of anxiety disorder, we're really talking about a whole class of different kinds of disorders, right? And particularly over children and adolescents, you might see that anxiety could show up in different ways at different points in time, right? So earlier on in development, we have kiddos who are transitioning into school and just sort of learning to navigate things. We may see more like separation anxiety when they're starting to become more aware of peer relationships. There could be social anxiety that starts to evolve as kids get older and they are thinking more, and that's a healthy thing that they are thinking about their thinking. They may end up in a position where they're doing a lot of worrying, as Mallory was just saying, right? All those what ifs, we think of that, we call that generalized anxiety disorder, which is really a worrier, right? Our classic worrier. There's also phobic responses, right? Which are like really intense anxious responses to really either specific situations or things, right? So anxiety can show up in all these different kinds of ways. And while it all falls under the same umbrella, there are actually like multiple different kinds of disorders that all go under that rubric of anxiety. And just a little plug, because in my clinic, we treat anxiety and OCD. Really, OCD is its own other umbrella of disorders, obsessive compulsive disorder, other types of obsessive compulsive behaviors. And I often think of them as like cousins to anxiety disorders. So there's a lot of overlapping components there. And folks who are anxious may also sometimes have OCD. And all of these things really operate in the same realm that we're discussing, where one's responses to stress and difficult situations, worries, obsessive thoughts is very intense. And then they may end up engaging in behaviors that really aren't working for them, right? So instead of handling that anxiety as a signal that they need to attend to in a healthy way, maybe approaching a situation, figuring out how to handle it or get adequate support, they may end up engaging in avoiding situations or doing compulsions or other unhealthy behaviors that really start to wreak havoc on life in a way that's really problematic.
Thank you. That was a great kind of overview of anxiety. And so to piggyback off of that, Mallory, you work with as the special ed chair you mentioned. So can you tell us a little bit about what that might look like, or what do you see more frequently among special ed students, verbal, nonverbal students?
Sure. So I think that, we're going to talk a lot about symptoms and signs of anxiety. This I'll focus just particularly on students with special needs and who have difficulty expressing themselves. So I think, with all students, but particularly with students with special needs, anxiety can certainly manifest in a variety of ways, depending on a student's specific challenges. When we talk about students with special needs who are verbal, even though a student may be verbal, they still may have difficulty communicating their feelings effectively, which can actually lead to increased anxiety and frustration. So something to look out for, certain signs. So they may express their anxiety, verbally, such as just really expressing a lot of worries, a lot of fears. Asking repetitive questions. So I know we have parents and teachers on here tonight. So if you find your child or your student is asking the same question over and over again, that could certainly be a sign of them feeling really anxious and just not being able to verbalize it. And the same goes for seeking reassurance. So we'll often see students with anxiety really looking for that reassurance that whatever they're doing or may, do in the future is going to be okay. It's another sign that could just, put a little light bulb to say, okay, my child or my student is expressing some anxiety and they're just they're not able to say it maybe in the way some other children may be able to. We also look for some physical symptoms like a lot of fidgeting, any changes in appetite, sleep patterns, a lot of restlessness. These are all signs that if your child isn't saying they're anxious, but you're seeing them, may be something for you to think about and look further into. With nonverbal students, it can be even more challenging and frustrating, of course, for you as the teacher or the parent, but really for them as the student. Any student who is nonverbal is likely to experience a higher level of frustration because they can't communicate the way that others may be able to. So in terms of how do I know if my nonverbal child or student is experiencing anxiety? I think that you would just look for signs like an increase in their challenging behavior. So students with developmental disabilities who may be nonverbal, they may present with challenging behaviors on a more regular basis. But if you start to observe an increase in challenging behaviors, that is really not like them. So really refusing, requests or instructions, hiding, trying to avoid learning, trying to avoid the classroom, engaging in any behaviors that might be unsafe to themselves or others, any type of aggressive behaviors, finding more times to be isolated and by themselves, And we also see an increased reliance on special interests, routines, or rituals. So sometimes students can have certain self-stimulatory behavior that is a coping mechanism for them. If you see an increase in this, these are all signs for us as the caregivers to pay close attention to make note that this child might be struggling with some specific anxiety and more trouble sleeping as well. I know we're going to talk more about some strategies as we move on tonight, but just very briefly, especially for nonverbal students, there are certainly strategies that schools and parents can put into place in terms of more visuals. So teaching them how to recognize their feelings by using visuals. So we have got a lot of tools that schools can use and share with families, like the zones of regulation, where they're able to identify how they're feeling based on different colors, based on different pictures. And the same goes for calming down strategies. We use a lot of visuals, breathing strategies, muscle relaxation exercises. So there certainly are ways to address anxiety in students who can't necessarily verbalize how they're feeling.
Great, thank you. And that was a lot of information. Yeah, we will talk a little bit more about strategies a little bit further as the conversation evolves. So to piggyback off of some of the signs and symptoms that Mallory shared, Nina, can you give us a little bit more about maybe what it might sound like, look like for youth who are experiencing, like what might parents hear them saying? What might parents see their kids doing if they're starting to develop some anxieties?
Sure. The other two guests gave such a great comprehensive overview of anxiety disorders and some signs and symptoms to look for. So I know that we're not necessarily discussing the criteria for various anxiety disorders, but I think that some things to certainly look out for is that high level of anticipation of future threats and that vigilance, like our other two guests have been talking about, a lot of tension and cautiousness. And for sure, something that I think a lot about with anxiety is that avoidant behavior. And when we get into strategies, that's something that I certainly want to speak further about. But I think this has already been touched on, but that frequent discussion of fears and worries and withdrawing or avoiding certain situations, that's something that families might see. And sometimes even worsening of academic performance, of course, is sometimes a sign because it's one of the major areas of functioning for a child. So I think another thing to think about is that reassurance seeking, like was just mentioned before, and the lack of confidence in your independent decision making. So, like everybody has said, those what ifs, but that real lack of confidence in independent decision making. And then some of the physical symptoms that were already discussed, like consistent stomach aches and headaches, lots of calls from the nurse's office. I think everybody who works in a school would be familiar with the calls from the nurse when it's, stomach aches and headaches, racing heartbeat, irritability, trouble sleeping, complaints of nightmares, sometimes low energy, or that restlessness that we see a lot. And then with younger kids, sometimes the frequent tantrums, which we were kind of talking about before, can be a sign of anxiety. And depending on the specific potential anxiety disorder, if we're talking all the way to the point of meeting criteria for a disorder, the signs and symptoms might be different, like Dr. Owens had said. I think something to keep in mind always is whether it's outside of the norm for the child's developmental stage and whether it's impeding or blocking typical functioning. So whether that's in the educational setting, socially, or physically, if whatever's going on, some of those symptoms and signs are starting to impede the educational progress or socializing or something physical. So it's how intense is it and also how persistent, I think, are things to really think about.
So I just want to elaborate a little bit on something that you brought up. You did talk about, you just mentioned about, something about being typically developmentally for kids. So can you maybe elaborate a little bit more on what might be typical for as children develop, and what might be more something that we should look at maybe that's a little bit more of a concern?
Yeah. So, and I know we were kind of talking about some guidance for families here. So, I think I might be getting a little bit ahead of myself, but that idea of pediatricians and school partners are a great resource for families when a family is kind of struggling to know, is this within the developmental norms, or is this something that's outside of the norms and something to be concerned about? I think, pediatricians and school partners see children all day long, every day, and they can easily help you sort out what's within the norm and what seems outside of the developmental norm. And I want to just circle back again to that part about if it's starting to impede functioning, for the child, but also maybe for your family. If you find your family kind of being required to make lots of accommodations and changes to typical functioning for the family, that might be a sign, and like the intensity of the distress, I think. So that's something. And of course, as was mentioned before, separation from a caregiver, for example, at 2 years old, what's developmentally normal in terms of that separation anxiety versus for a 16-year-old, So I think it's that you can partner with other people who maybe have a bigger scope of what's within the realm of norms.
Thank you. And along those lines, Mallory, I know that might be a little bit more difficult for parents with students with special needs because they're, not typically developing like their peers. So how can we tell for those parents and families if their child is developing some anxieties when they're already kind of not behaving the way that their peers would be behaving? You're muted.
Sorry. So that's a great question. And I think, of course, it's going to be very individualized to each child with special needs because each child is incredibly unique with and without special needs. But I think just to make it more concrete for parents and teachers who work with special education, I would look at certain areas in determining, is this anxiety becoming more, a negative impact in the child's life? So one, I would look at like duration and intensity. So like we have shared already, anxiety is a typical feeling. We all come in contact with these feelings of anxiety. They come and go to, specific events that we should feel anxious about. But if we start seeing the duration and intensity increasing, and it starts interfering with daily functioning, that's one area to indicate a more serious issue. And your child, your students so well, so you'll know what that barometer is, if it's typical or not, when we talk about students with special needs. Again, this may be a bit repetitive to what we just discussed, but impact on daily life. So is this something new that's impacting a child's ability to engage in the activities that they normally really, really enjoy? Spending time with friends, with family, preferred peers, daily tasks that they really enjoy doing. If they are starting to avoid those things, that's definitely a sign that there's something more serious that may be going on. Any sudden behavior changes. So if your child is all of a sudden becoming really irritable, withdrawing from social interactions and other events, that may be a signal of concern. And I think overall, just how they function. So if there's any functional impairment. So is this distress showing up in many different facets of a child's life? So is it happening at school, with relationships, at home, with family, with recreational activities? If we're starting to see this pattern, I would say that's a time to, trust your instincts and seek out additional support.
Great, thank you. So Meredith, now that we've had this conversation about signs and symptoms and kind of what we should be looking out for, do you have some tools or strategies that families and caregivers can maybe use with their children that they're starting to see some of these behaviors and concerns?
Yes, absolutely. And first of all, and I know there's two questions. It's always like, how do we prepare kids and families for these eventualities, since we all do experience stress and anxiety sometimes? And also kind of what do we do in a moment of crisis, and because often both things are important, but they may be different. So I think that the introduction and really weaving in of social emotional strategies within the educational system has been so important, because now it is just common language, right? Kids know mindfulness, kids know breathing strategies. Right now, when I get a kid into treatment, it's unusual they haven't already heard of these things in schools. And so it's so important that that's happening, because it's not in the moment of crisis that you want to be first figuring out, how do I teach my kid to do deep breathing, right? So when it's a moment of intense crisis and your child is having something that looks like a panic attack or something that's a very intense response, right? We don't want to be scrambling with something new in that moment. So in more of a crisis moment, we probably want to do the best we can as adults to model being calm, right? And that's much easier said than done. If anyone's ever been anywhere near someone who's anxious, it's literally contagious, right? It's like a tuning fork. You're got one dinging, you get the other one just close by, it starts stinging too, right? And so we're naturally programmed, especially as empathic people, caregivers, and teachers and psychologists, right, to respond empathically when someone else is anxious. So it can also work for us. So if we work on kind of calming our own bodies down without saying anything at all, that may be like the number one most important thing you can do when you have a child or any person really who's having a really intense, anxious moment. If you get them calm or collaborative enough, I would definitely say you could invite them to do something with you. So definitely wanting to come alongside that child, right? When someone is having a very intense, anxious moment, they're often feeling really, really out of control. Right. And so even though our instinct may be to try to control the situation and get the child to do something differently, unfortunately, sometimes that can really backfire on us. Right. So instead, we really want to keep ourselves calm, come alongside that child or adolescent, and maybe invite them. Maybe we start deep breathing very obviously and invite them to join us, right? Or something like that. If it's a younger child, maybe you start playing with a toy or drawing something looks interesting, and then they may be coming alongside you to join, right? So I think trying to both keep ourselves calm as adults in the moment, and then if hopefully our children have already been exposed to different strategies, it's already in their language, it may be easier to pull in the moment. Like, hey, remember that worksheet you came home with from the SEL lesson the other day? What was on that again, right? Trying to kind of really engage that child to collaborate with you to do something different that might help to calm them down. But probably the most important two key things are keeping yourself calm and trying not to engage in a power struggle with that child to make them calm down, because that's likely to just kind of explode the situation further, which we really, really don't want. And just to kind of add to, a couple of people use the word reassurance, which is such an important word and something that, depending on how we look at it, people might see it differently, right? So in my lens, as someone who treats anxiety disorder, reassurance is a bad word, right? So we don't want to do a ton of reassurance for kids, especially who are really anxious leaning toward the direction of an anxiety disorder, because in a natural human interaction, when someone is distressed, again, we feel inclined toward wanting to bring that person's anxiety down and calm them down. And, maybe everyone's entitled like one reassurance, right? If someone really doesn't know the answer to something or really doesn't know how to handle something, of course we want to guide them and we want to support them. But if you're noticing, as these guys have said, repeated questions, the same reassurance again and again, as a parent or a teacher, you've gone over these instructions or this topic with this kid at least 3 or 4 times. Now we're going into a place where this is now an unhelpful and unhealthy, anxious behavior, right? So the other thing we can do if we're noticing a ton of reassurance seeking is to do our best to validate and maybe help the child label those emotions, right? Oh, it seems like anxiety is really showing up for you right now, right? And refocus them on, instead of trying to get rid of that anxious feeling, maybe identifying whatever the situation is, what the goal is, what they meant to be focusing on in the moment, re-engage them in like a productive way, right? And to not get stuck in that power struggle with trying to get rid of anxiety by providing reassurance after reassurance, because otherwise it ends up being like you're trying to put water in a bucket with a hole in it, and the more you pour in, it just keeps coming out, and it's exhausting, right? If you ever have dealt with an anxious child or person, right, it's like eventually you just get really frustrated. And that's when parents or teachers, sometimes we lose our cool too, right? We get frustrated. So trying to nip that reassurance in the bud before it gets too big and too hard as a pattern is super important. And it models for the kiddo or the adolescent that we're calm, right? We don't need to keep going over that topic again and again, right? We addressed it, we answered it, and now we're going to move on to something else.
Thank you. Those are really useful. And I like to use the visual of like a duck on a pond where, the duck at the pond is just floating and serene, but underneath the feet are going really fast. So as an adult, like being that duck on a pond and being like calm, but you can keep inside, your heart can be you can be breathing like them, but just on the outside, you have to be calm. I like that. Nina, do you have any tools or strategies in addition that we can maybe use with our youth?
Sure, that was a really comprehensive answer. I agree with the piece about how it's so wonderful that so many of our of the children who are in school already are aware of the coping skills with some mindfulness and relaxation and breathing, which I think is excellent. I think what I would add is more of these, if we're talking about what families can do, some of what I would call kind of proactive upstream kinds of things that families can do in terms of encouraging healthy sleep and nutrition and movement and exercise and the importance of fun and social connection, for validation, which we've already talked about, but also for help seeking and getting outside in nature. There's so much research about that. So if I were adding on some things, I think it would be that. And then the piece that, typically when we're trying to assist or support a child when they're dealing with anxiety, physical strategies are often it's kind of the way our bodies and brains work to kind of try to use some physical strategies so that then we can access our higher level thinking for some of that other stuff. So I love that we've been talking a lot about reassurance, and from the psychology standpoint, kind of that balance between, supporting and validating without, I guess, a term that sometimes I talk a lot about in my private practice is this concept of accidentally assisting a child in having a self-concept as fragile. So we don't want to accidentally send the message to children that they need to be rescued or that an adult needs to fix things for them, because it can kind of turn around and create more of a self-concept that the world is dangerous and I can't handle it on my own. That kind of like the concerns and vigilance about threats, we can accidentally kind of reinforce that concept when we're jumping in to fix things and rescue things and help children solve their problems. So I think that piece, we've already talked about, but really encouraging independent problem solving, not necessarily right in the moment when a child is very anxious, not for the first time, but again, kind of upstream, encouraging independent problem solving, whether it's with a little one, putting together a puzzle and trying to find the spot for the piece in the puzzle, or whether it's a teenager trying to navigate like a social situation kind of dilemma. That idea of encouraging the independent problem solving, I think, and like we talked about before, that piece about validation, that can be a tricky one about kind of rather than kind of accidentally invalidating a child by saying like, oh, don't worry, or that's not a big deal. There's a balance between saying, oh, I think like Dr. Owens had said, labeling the feeling that the child is feeling, or saying that you can understand why they're feeling that way given what they're worried about. But I think just to kind of piggyback off of what we're talking about, instead of reassurance seeking or picking up the phone and fixing it for the child, maybe asking the child some questions that really encourage independent problem solving on their part. Like, what are you worried is going to happen? And then that piece on helping them to focus on what's under their control and what would be productive in the moment, I think.
Thank you. I think that's really, all of us parents have to remember not to jump into mama bear mode and go fix it for them right away, right? Teaching them those independent skills is so important. So my next question is, when should a parent or caregiver discuss their anxieties with you brought up talking to the pediatrician, you brought up that there are people in the schools, social workers, school psychologists, wonderful support staff like all of you working in schools. When should a parent reach out and start having that conversation, either that they're noticing that there's an issue or that the child has had a diagnosis? Like, when is an appropriate time to and how do you start that conversation? I'm gonna start with Mallory on that one.
Sure. So I think that really it goes back to a lot. I think all three of us have addressed what anxiety could potentially look like and how it could impact different facets of a child's life. So I think when we talk about when is it time to reach out to a teacher or school's mental health professional, I would again look at some of the signs of if your child is experiencing that persistent or excessive worry or fear in a way that it's starting to impact their daily life functions and relationships. I think those are two areas to certainly to certainly look for. Another thing that we haven't talked a lot about is some of the physical symptoms of anxiety. Now, if your child all of a sudden is starting to complain of frequent stomach aches, frequent headaches, difficulty sleeping, these are some physical symptoms, and you know that this is not common for your child, and they're at the same time expressing an increased level of worry or fear about the future, any, uncertain events paired with any sort of these physical symptoms. Of course, as a parent, myself, the first thing I do when, my children complain they're not feeling well is I go to the doctor. But if it's starting to become a pattern where it's a stomach ache, it's a headache, and the doctor is not noticing anything medically wrong, that's telling us that it could be stemming from more of a mental health place that we really want to address. And that's a great time to have that conversation with your child's teacher, or ask, your child's teacher to point you in the direction of one of your school's clinicians. So one of the counselors, social workers, psychologists. The other area that I would say it's really time to reach out to the school professionals, and we talked a little bit about this, is when you all of a sudden really start seeing a decline in their overall academic performance and their difficulty even concentrating. So whether you're hearing that from your teacher or you're seeing it at home, unable to concentrate doing homework, even unable to concentrate maybe by playing a board game, you're just seeing a lot of that, kind of maybe even just going off into their own world, their thoughts are taking over their ability to be in the present moment. And oftentimes we'll see that in school, that really does interfere. So they could be sitting there through an entire instructional period and they haven't comprehended what the teacher is saying, not because they're incapable, but because their anxious thoughts are taking over and they're missing what's going on in the classroom. And then you're starting to see that in terms of their academic performance. And again, anytime you hear from your teacher, from your child's teacher, that they're noticing any of these symptoms in the classroom, I would just right then and there partner up with your teacher, get the school clinicians involved, continue that communication, that collaboration. I say the more transparent we are, that homeschool relationship is so incredibly important. And we find a lot of success when there's that homeschool collaboration. So, really anytime, I always encourage families to reach out to the schools, teachers and clinicians and any mental health providers. But certainly if you're seeing any of these symptoms, I would not, take any time. I would encourage you to reach out immediately.
I'm actually going to jump in because there's a couple of school-related questions in the chat that have been posed by some of our attendees. One has to do with panic attacks and anxiety at school, specifically around school things and about tests or about assessments. Do you have any strategies? And I know, Nina, you also work in schools too. So the school professional, those of you who are in schools, to be able to see, are there strategies? So Nina, if you will jump in first, maybe for that one, to see if there are some strategies and things that we as parents can do to help support our children and give them some strategies to maybe stave off some of those when it comes to assessments at school.
Sure. So we were talking a little bit about panic, but then also anxiety about assessments at school, kind of two things. So I think some of that, again, there's going to be physical strategies and then there's going to be cognitive strategies. And it is hard to teach these strategies in a moment of escalated anxiety. So it is a good thing to kind of build up these skills at other times, so that then the child is able to use them in moments of heightened anxiety. So I guess if we're talking about the panic piece, I know that this can be a really heart-wrenching kind of situation for families to see their child struggling, because a panic attack or panic symptoms can really be intense, and it's hard to see your child in distress. And it's really kind of a pivotal time to partner up with the school if it's happening at school, because we want to make sure that we don't accidentally create a situation where, the child is feeling panic, gets picked up from school and immediately feels relief, because then they start to condition their body to feel like that's the only way that they're going to feel relief. And oftentimes with panic, and I'm sure the other two guests could jump in, but, panic attacks do not last forever, and that it's intense and then it goes down. And if we can figure out ways when we partner school and home together to have the child, remain, even though that can be very difficult to support when you see your child in distress, I think that that's a big piece to really partner and have the child start to recognize that those symptoms are going to dissipate or go down even at school, so that we don't accidentally create a situation where they feel like they need to leave to feel relief. And then with the test anxiety, that goes into this realm of really helping the child to think about things differently, that growth mindset kind of idea. But I think a lot of it can also be, we do some workshops in my wellness center now with students at our school's wellness center about the idea of using those mindfulness strategies and the breathing strategies, because once your brain is very activated with anxiety, then you can't think clearly and you can't think logically, and your mind does go blank. So it's not like a quick fix where like, oh, one day you're going to try this strategy and now you're not going to be anxious during tests. But it's really about embracing kind of like a growth mindset, that this is going to be a long process of changing up the way we think about failure and numbers on tests, and really that idea of working on the practice of being able to get physically calm so that we're in the best position to use all of that information that we studied and our logic, and to think loosely to solve problems during tests. So I know those are complicated, they're two different things and they're complicated answers, but I think that the key there is obviously family support, because families are the most important things to the children. And so like that idea of really being a partner with the school and supporting your child, and not encouraging avoidance or escape necessarily, but really like support to get through it.
Well, and it sounds too like almost preventative. It's the preventative medicine, and it's the preventative strategies in knowing that if this is a situation that your child might be dealing with, to give them those tools and give them those strategies and practice them before it becomes an issue, so that they have those tools at the ready when they need them, is a huge piece, I think, for parents too. What about, just to piggyback on that one too, and Dr. Owens, you may be able to help, or Mallory may be able to help, but what happens if there was a question in the chat about a child who has separation anxiety when with peers, but is fine at school? So separation anxiety and doesn't want to leave their parent, like at a birthday party, with peers, but is fine at school. So what was strategies, or what would you suggest for someone who has the opposite issue? School's fine and peers are the anxious part.
Yeah, and that very well can be the case, right? So anxiety is often very context dependent, and you might find some kids, their anxious triggers are at school, sometimes they're not. Sometimes for some kids, the less structured environment of a social situation can be far more terrifying than in school. They have rules and clear expectations, and they are where they're meant to be. And I think like with most of these things, it is complex. It's probably, first of all, not something that shows up all at once, and it's not something we can fix all at once, right? So it really is something that requires, as Dr. Weisenberg was saying, with the panic and the test anxiety, an identification and a clear plan, and then like supporting your child through it. I think similar to the panic example, probably the most important thing we want to try to do as parents is not to facilitate our child's escape, right? Or over accommodate that anxiety, right? The number one sort of unhelpful response to intense anxiety is avoidance, right? So that's what creates an anxiety disorder cycle, right? We get triggered, we feel anxious, it's really uncomfortable. Our mind starts to kind of mislabel being uncomfortable as dangerous. And then we feel really intensely like we need to escape that situation. And if I'm a child, right, I'm not just able to escape myself, I have to enlist an adult usually to help me through that. And so that actually gives us a lot of power, helpful power as an adult, that if we can not be the facilitators of our child's escape in those anxious situations, that's probably the best thing we can do, would be to model it. I think development really plays a big role here, right? There's also a very big difference between taking your 6 or 7-year-old even to a party and having them feel anxious and kind of wanting you to hang out for a bit, versus your 16-year-old, which surely none of the 16-year-olds are going to want you there, right? So that's a whole different story. But depending on what you really think your child can do versus won't do, right? I think doing your best not to accommodate that child or bargain with the child if it's not developmentally appropriate for you to remain at that party, right? And do your best to express confidence in your child's ability to cope, right? Instead of trying to talk them out of it or lecture them as to why they shouldn't be anxious and maybe accidentally invalidate them in the course of trying to be helpful, we can acknowledge like, oh yeah, I know that sometimes anxiety shows up for you in these social situations, and that's really hard, and I'm really confident in your ability to get through it. right? And your child may not really like that answer. They probably won't if what they're looking for is for you to rescue them. And doing our best to, like that duck in the water again, like we're keeping that face up here, even if in our chest where our heart is beating and we're walking away, hoping that child isn't going to run out the door behind us. Right? It's kind of like on the first day of kindergarten when you drop your kid off and you're terrified, you put in your glasses so they can't see that you're crying, and then you go home, right? So we really have to start with modeling that and trying not to get roped into rescuing them. If it's not a dangerous situation, they don't need our rescue. And when we make all those accommodations by telling them they don't have to come or I'll stay or all those things, all that bargaining, we unwittingly communicate to them that A, they can't cope independently, or that situation is horrible and terrible and dangerous and they should feel anxious. So we really want to try to express that confidence instead of kind of operating in that rescue mode for sure.
Thank you so much. So when having these conversations, right, and this is such an important conversation, we're so happy to have the three of you with us on this. And I know that over time, right, the stigma around mental health, these conversations are really trying to break it down. And we have a wonderful audience with us about this conversation, but it's different when you're having this conversation about generally youth and when it's your child. So how can a parent overcome that stigma? What can they say when they go to the school and they're looking for services, they're looking for supports for their child who's having anxiety, but they have to but I think we all have to overcome our own personal stigma around it, right? Not my child, not, what is it going to mean for my child in school if people know, or what is it going to look like? So Mallory, maybe you can start off with the special needs and the language around that, and then we can jump to Nina about, like, just in general, what kind of language can we use? What can we do to kind of overcome that and get those supports? And what can we be asking for in schools?
So I think that, what we strive to do, and I think this has been the trend in terms of any sort of special education supports or services, is create very inclusive environments. So inclusivity, doesn't have to just mean special education, but just a completely inclusive school environment where people feel that they can openly communicate with their teachers, where the parents, from child to teacher, where the parents feel they can have open communication with the teachers as well. I think just in terms of starting off the school year with that level of open communication creates a safe and supportive environment for parents and their children. When we're talking about what can parents request, so I'm going to, look at it from my lens where I deal with a lot of students who are identified as requiring special education supports and services. So we're talking a lot about anxiety. And even I thought of this when we were talking about the test anxiety. If your child's anxiety is so much so, it's so significant to the point where there has been a pretty marked period of time now where they may be receiving, maybe even outside of school, some therapeutic intervention, and you're still seeing that it's significantly impacting their academic performance in school, then that's the time to consider potentially looking at special education supports and services. There is a process to that. You can make that recommendation. You can start with your child's teacher, and then they would point you in the right direction on who you can request that from. And in that process, the committee, which parents are key members of, make the determination if the child's anxiety for a marked period of time is significantly impacting their academic performance, then they may be eligible for special education. I am at a lot of these meetings, and they're very sensitive meetings, and they're challenging for parents, and I can, empathize with that and understand. And I always tell parents that we do unfortunately have this stigma that we're trying so hard to get away from, but it's just as if, in order to, if your child had, diabetes, in order for you to get their medication, they have to be diagnosed with diabetes so that the pharmacy will fulfill their, prescription. So in order to get special education supports and services, we do have to determine that your child has a academic disability. And that can certainly be from the emotional realm. It doesn't mean that they have a learning disability, but there is a totally separate section for an emotional disability or a health impairment that is impacting impacting them in the school environment. And what I say is that, I know at least in my district, we strive for that inclusivity. So students don't necessarily know, I'm in a high school district, so it's a little bit different than elementary school, but okay, the bell rings, I'm going to my math class, on the first floor, and my math class is on the third floor. And no one knows, oh, that's a math class for, that's led by a special education teacher or not. And we strive to make students feel comfortable so they don't feel stigmatized in any way. We also, and this is across New York State, are striving for as much co-teaching. So students, general education and special education students, are in the same classroom with two teachers, and the students don't know. They just think, these two teachers are my two teachers. And the whole model of co-teaching is that you don't know who's the special education teacher or the general education teacher, and the students don't know who's who either. And especially in a high school setting, we have a huge counseling center where we have our counselors, our psychologists, our clinicians. And yes, there are students who go down there because they do have a mandated service of counseling on their IEP through special education. But the amount of general education students that love to pop in there and love to talk to the counselors, so it also becomes very inclusive. And I think because social emotional learning has also been such a push across New York State in schools, we're requiring our, geometry teacher to know how to also implement social emotional learning into their classroom. So many of these students are becoming more aware of their anxieties, perhaps more aware of the supports that schools offer. So I think I might have went on a little bit of a tangent, but I think these are just some of the ways that I've seen this stigma, especially, over the past 10 years. There's, 20 years, even more so. Special education is viewed so differently than when we were younger and in school. So I do a lot of parent education in my meetings, and I strive to have my parents leave those meetings with less anxiety than they came with. And to understand that if your child does receive special education supports, this is very fluid. So our goal is that they may not need it throughout their whole academic career. It's reviewed annually, minimally annually, and it can change. Maybe they need more support next year. Maybe they need less support next year. So this is something that's very individualized, and in working with the schools, my hope is that families become more and more comfortable with allowing the schools to intervene on this higher level. That's more than just the general education interventions that we offer.
I'm gonna quick jump in if I can, to ask Nina a quick question. There was a question in the chat about, specifically about anxiety and the difference between having a 504 or an IEP, for anxiety. When would each be appropriate? If there is anxiety that is causing a significant impact on academics or, social, concerns in the classroom.
Sure. And perhaps, Mallory, you would want to jump into from your perspective. But I guess one of the things to think about here is with the Section 504 accommodation plan, that's usually because there's an identified impairment that's having a significant impact on a life function, versus in special education, it's reaching the criteria of being educationally impaired, which is something, right, that Mallory had just discussed before. I know in a lot of schools too, one of the differences between, say, an IEP and a 504 plan is the piece about like direct services, not necessarily at every school, but sometimes 504 plans we often see with testing accommodations or program modifications to kind of what they call level the playing field, to give equal access to education sometimes, or to a facility, something like that. Whereas IEPs often have direct services as opposed to testing accommodations or program modifications. I think something that might not be the most popular thing to mention here, given what we were talking about before about anxiety and anxiety disorders and avoidance, it can be something to really think about together with the school and home about if a child is experiencing anxiety, how to best support the child in working forward in that situation. So I think sometimes it really takes a thoughtful conversation or many conversations to really talk about what would we want to put in place for this student who might be struggling with anxiety, so that this student continues to move forward and approach a situation rather than avoid or escape. I guess that's just something to mention when we're talking about all these things, and something I wanted to kind of also say, and something that we often talk about in special education, but everywhere, is this pre-referral strategy kind of idea, or a response to intervention. So I love what Mallory was saying about how I see too, after working in high school for 20 years, that there is certainly less of a stigma about talking about mental health struggles or even just emotional struggles. And I think it's wonderful, because then it opens us up to being able to have wider discussions, psychoeducational discussions about coping skills that we can all use for our life. So I think sometimes when we reach out to the school, if you wanted to be really kind of specific with examples about what you're seeing that has you concerned, and then that way maybe you can partner with the school to hear what are some things that have worked for other families. Let's say if there's a sudden recent change in terms of avoidance or hesitation to go to school, or something going on with test taking, to open up to the school and have some specific examples of what you're seeing also allows the school to kind of tell you about what has worked for other students before. And I think that can be a starting point before talking about referrals for a 504 or referrals to the CSE for considering an IEP. I think in both cases, you want to kind of try some pre-referral strategies first, and then that gives any committee a little bit more information moving forward, if despite many attempts or different kinds of strategies that often help, if the child is still struggling. I don't know if Mallory has anything to add to that part about 504s and IEPs.
Yeah, that was perfectly said. The biggest difference here is that there's the academic impact. So in order to meet the criteria for special education, we must see a significant and adverse impact on a student's academic performance. Whereas if your child is diagnosed with an anxiety disorder that's impacting, let's say, just they're having that test anxiety, or they're experiencing separation anxiety coming to school, yet they've learned some compensatory strategies, so they're able to academically perform, but this is still impacting one of their life functions. That it's 504 is a more general criteria where we can put into place, just like Dr. Weisenstrider said, testing accommodations, in-class accommodations, whereas on an IEP, it's more specialized programs of instruction and direct service. So whether that's a smaller class, a co-teach environment, a service such as counseling or speech therapy, that is more so what you would see on an IEP as opposed to a 504.
Great. Thank you both so much. So we are just keeping an eye on the clock. I have time for one more question, and I want to ask Meredith for you to briefly give us some information or some tips. When do we go? This has been a great conversation about how to help our kids at home, in school. When do we go to outside mental health professionals, and maybe some ideas about how to make that first step and finding somebody who can support our students outside of the school and outside of our home?
Sure. And I think just to add to what these folks were just saying, that I think starting, especially if the anxiety is showing up at school, with your school-based health professionals, mental health professionals, is really important. And that often they're the best people to be in the position to say, hey, you may need some outside supports to help augment the support that they're doing in the building. And as an outside provider, it's so important for me, when a child's anxiety is showing up at school, that I'm also partnering, of course, with the family's permission, with the folks in the school. And so for families, I know on my other, the other side of it, I think sometimes families are very anxious about allowing me to reach out to schools, right? And not wanting, maybe wanting that privacy of a private treatment, and not necessarily knowing, letting the school know what's going on. But I often say that the school probably already knows there's something going on, and that actually opening up that dialogue means that we're all working together, instead of kind of adding to that stigma of not telling this person or that person, or maybe even unwittingly communicating to your child that it's not okay to tell anyone at school you're in therapy, or that you're working with a mental health professional, right? I think the more open and communicative we are, then the less stigma there is, and the better we can all work together. So I think starting with your school-based health professionals, mental health professionals, your pediatrician, your child's pediatrician, those are usually folks who can help connect you to local providers. On a broader level, there are really wonderful professional organizations that focus on anxiety and OCD and just child mental health in general, right? So looking online to there's an Anxiety Disorder Association of America, which has a therapist referral list. There's the Association for Behavioral and Cognitive Therapists, right? There's all different kinds of resources online that can also connect you with these different specialists who may be best suited to help your child. But I think in terms of your local area, working with your schools and pediatricians is probably the fastest way to get connected to the people who can help.
Thank you so much. So we are really up against the clock, and I do want to have some last thoughts from each of you. Overall, like what can we do? What can our parents walk away today doing? Like, what's our first step to support our students? So I'm gonna go with Mallory first. Your last thoughts for this evening.
I think the biggest takeaways that I would encourage parents is utilize your school resources. Every school has either they call it a counseling center or a mental health team. So really utilize and tap into those resources. Early intervention is always best, but it's never too late. So whether your child is experiencing anxiety and is in kindergarten or is in high school, it's not too late. So but the earlier that you recognize that there's an issue, I would say intervene. Don't waste any time using your school resources. And I would say communication and collaboration with schools is extremely important and beneficial for your child's success.
Thank you. Nina, any last thoughts from you?
I guess just to add something different than what was already said, maybe for families to really think about those upstream everyday lifestyle strategies that families can be encouraging in terms of truly, like, there's so much emerging research about the importance of nutrition on mood and ability to handle stress and things like that, and sleep and the importance of sleep with anxiety. So nutrition, sleep, exercise, and movement, and the importance of fun and social connection. So, families are just a wonderful source of social connection for their children while still encouraging independence and confidence.
Thank you. And Meredith, last thoughts for tonight.
Yes, I agree. And I'm going to add to that, I guess, upstream consideration with not really waiting until there's an issue, but definitely thinking about mental health and supporting good mental health from as early as possible, right? And that's engaging all those healthy activities alongside your child and also modeling healthy coping and that having a whole wide range of emotions is healthy and normal, right? So the more that children, adolescents see their trusted adults expressing in appropriate ways, oh, I feel sad about this or anxious about that, and this is how I'm handling it, right? I'm going to yoga this week, or I'm going on a walk. Those modeling behaviors are probably the most powerful things we can do as an adult, and even more important than what we're trying to get them to do differently, right? So trying to use yourself as the model is really a healthy thing to lay in foundation for your child of good mental health.
Thank you. Those are three wonderful and beautiful points to end tonight with: family support, being healthy, listening to your body, and parents modeling for their kids the behaviors that we want. I want to thank the three of you. This was an immensely meaningful and relevant conversation for all of our families on this call. So we really appreciate your expertise and breaking it down for us and having this conversation with us and answering our questions. This is really, really an important topic for our organization. Amy, do you have any last thoughts or any?
No, and a very heartfelt thank you to all three of you for being panelists and for sharing your knowledge and your time with us this evening, for making some of these answers and some of this knowledge available for our members as well. For those who asked questions in the chat that we didn't get to, I apologize. We were just up against the clock. I will do my best to try to see if we can get answers to some of those for you in the coming days. We'll see if we can get some of those answered that we didn't get a chance to for tonight. But again, heartfelt thank you to all three of you for being here and for sharing your evening with us.
Thank you for having us.
I want to thank our panel for being here this evening and for putting anxiety into such simpler terms for us that we can all understand. Again, thank you very much. Thank you all for joining us this evening. Hopefully this webinar helped to open up the mental health dialogue in your home and is giving you some tools to help you. Look forward to our next webinar. We'll be talking about social media. Thank you again, everyone, and good night.